Thank you for staying with us. It's always a joy to have your company. We appreciate you. On this next leg of the AM show, we talk COVID-19, but from your perspective. What are your questions? What are your thoughts? What are your concerns? I mean, does it have to do with vaccines? Does it have to do with children contracting COVID-19? What do you think as a parent whose children are back in school when it comes to COVID-19? Do share with us this morning by calling that number 0302-211-691 extension 2. It will be rolling on your screen shortly. 0302-211-691 extension 2. Do share your thoughts with us. Today, it's a Q&A session, and we're offering you that opportunity to ask the experts. That's our hashtag this morning. Hashtag Ask the Expert. And the expert we have in the studio this morning, Dr. Yaw Bediako. He's an immunologist and research fellow with WACBIP of the University of Ghana. He joins us this morning. Doc, a very good morning to you.
Good morning.
You know, that smile of yours, sometimes it just gets me. Oh, yeah. But you know, even with the mask, when you're smiling, it's pretty visible. But thank you so much for coming back.
Thank you for having me.
Right before we kickstart the conversation, though, I just want us to take a quick look at this video. I'm bringing it up because it raised a lot of issues, a lot of concern for me. Just take a look at it. It's very brief. Take a look at this.
That if the issue of visa contractants is to become personal complaint in the system, I'm putting that to you, my lord.
I believe we can. Let's do this again. It's so brief that you may have missed it. Let's just do this one more time from the back room. In that video, it will be played again shortly, but Dr. Bediako, you saw the video. And let me just make it clear that we shouldn't blame the child in the video. It's a child. But basically, let's take a look. Just watch. So he's going to wash his hands, follow the protocols, dutiful child. But then he realizes the water isn't flowing. And what does he do? Next best thing that comes to the mind of a child, dip his hands in the water in the vessel below, where everyone else has been washing his or her hands. And I mean, that could have been Corona right there or something that he just dipped his hands into. Your quick thoughts?
I mean, I think it shows the challenges you have in enforcing these restrictions. I mean, these are children. Actually, you think it's kind of a smart thing he did. I mean, as far as he's concerned, I need to wash my hands. There's water there.
Yeah.
And this is why, you know, enforcing these restrictions and providing these measures in schools provides a bit of a challenge because clearly the Veronica bucket was empty. Maybe a lot of children had come and washed their hands previously. So these are just a few of the issues that potentially can arise and why perhaps hand sanitizer as well as hand washing. Because if at least he dips his hands down there but then does get hand sanitizer, hopefully that would counteract whatever he may have picked up from the bucket below.
Right. Anyway, so let me just insist on this. The numbers, you can start calling them. This session is all about you. I have my own questions, but I know you have yours too. So do share with us and let's dig into them. Sometime last year, I heard, pediatrician and, infectious disease expert, Dr. Jocelyn Dame, talking about children getting COVID-19. This was, to be fair, this was somewhere in April. I mean, just around the time when we're getting into a lockdown and all of that. But her take at the time was that there was no proof or evidence for mother-to-child transmission of COVID-19. But here we are. We've seen a lot of children nowadays, in recent times, I should say, go down with COVID-19. Some of them only months old, some of them even days old. What is the real picture when it comes to children contracting COVID-19?
All right. Yes, I think you're right. In fairness to Dr. Damia, early on there was limited data available on anything about COVID. Now we have a bit more information. It is true that COVID does appear to preferentially affect older people, so elderly people with underlying conditions appear to be more affected by severe COVID. Children are still less likely to present with symptoms, not meaning they can't get infected, but it appears that they may not get as sick. But it's a numbers game. So proportion-wise, in the US, I think currently maybe 12% of cases are of children. So that means, 88% of the cases are in adults.
But what's our case in Ghana?
I'm not sure. I mean, in Ghana, the challenge we have obviously is testing, right? So we typically, our testing strategy revolves around symptomatic cases. And since children are less likely to be symptomatic, we're probably missing a lot of positive children. But even if it is something similar, maybe 10% of cases are in children, or maybe even less, the issue really, I guess, as a parent is if your child is one of that 10%, it doesn't really matter anymore. So I think currently the picture is that on the whole, most of the people who have been afflicted with severe disease have been adults, but there have been cases, in Ghana of children getting very sick with COVID and dying. So it's not that children are entirely immune or protected. I don't think that is what should be assumed. But I would say that it is still the fact that the people who are most at risk of COVID are adults and elderly people.
Right. The number still remains 0302-211-691 extension 2. Do call. Let us know what your thoughts are. Great. Okay, so we have Ernest from Bibiani on the phone. Ernest, good morning to you. Thank you for joining the conversation. All right, so let's go on to John now. John in Cape Coast. John, good morning.
Good morning.
Great to hear from you. What are your questions for Doc?
Yeah, my question is, first one, is it right after a school of 21 people have been infected in a school, is it right without testing all of them, authority to tell us that they have just fumigated the place? And is it right for the school to go on?
Okay, so you are talking about...
Without
all right,
testing
go on.
all of them to isolate those who have been infected. Is it right for the school to continue with just fumigation and physical, what do you call it, isolation of those they think they have been infected? Is it right?
All right.
And secondly, how many people can one person who has been infected infect?
Okay. Thank you very much, John, for sharing your thoughts. When you call, do make your questions very brief so we can take as many as possible. Let's now connect with Ali in Fofwane. Ali, good morning.
Yeah, good morning.
Thank you for joining us. What are your questions?
I'm needing to ask this about the little boy that who was washing his hands at the bone.
Yes.
About what he's done, is it fair or they can do something about it? Or how they see the boy, they will go and contact him to bring his hair back to come and wash his hand again, or what is it? I'm so worried about that.
Grave concern, and that was my concern too. In fact, I felt that whoever was filming, because you can tell it likely is an adult filming there and snickering, laughing in the background, that was a bit, instead of actually letting the child do the right thing. But thank you. Ahmed in Chibi is up next. And before we get to Ahmed, Doc, looking at the sequence of questions, you might want to note some of them down so we don't lose any. Ahmed, good morning to you.
Good morning.
Your questions are?
My question is about the vaccine. I don't know which work it does. Because it is now out in countries. They are now vaccinating their health workers, but still the COVID is not coming down. I don't know if we vaccinate to prevent persons from getting it, or we vaccinate people who have it already so that they will be fine. Okay. I don't understand the meaning of vaccinating people.
Right. Ahmed, thank you very much. So why vaccinate in the first place? Thank you. Nu in Wale Wale is up next. Nu, thank you for joining us. What are your thoughts?
I just want to comment on what the guy has done. The guy did in washing their hands.
You mean the boy? Yes.
Most of the villages, especially Walwale and Walwale surround, we are lacking of water. So even putting up the Veronica buckets, they will be there, shortage of water. Even the community themselves are suffering to get water. So it's normal. I saw one girl last day. I asked her why she did that. The thing was the nose mask itself was dirty. She found it very difficult to wash it in the house. When she got to the school, she couldn't find water.
Wow.
She decided to dip it into that same dirty water. and wash it. So she used it. I then ordered her to go home and put water and rinse it before she can use it. So that one is just a challenge. Because the issue is that a lot of people are not, almost most of the community, there is shortages of water in which we find it very difficult to go with that.
Right. No, thank you very much. Did I hear you saying something else?
No.
Okay, thank you very much for making that point. But so sad, Doc. So that someone else, in some communities, because the water supply is simply non-existent or not there, they have to use other means of getting water. Some people even in the same water where they've washed their hands would go and wash a face mask. How? And we're treating this, I've heard conversation, we're treating this as though it were an urban problem. But what's happening in the rural areas? Anyway, let's quickly have you react to some of these questions.
Yeah, no, I think I'll take the idea of the fumigation and the water. I think the challenge we have is, and this is where you see that you can have the best plans, but then implementation sometimes is a challenge. So the plans for getting children back to school was, I would say, probably quite well thought out and tried to address the concerns or the dangers that children might face when they go back to school. The problem is, across the country, we have a disparity. We don't have the same conditions. Children going to school in Accra or Kumasi may have very different conditions than children in Wale Wale, as the gentleman is talking about. So it's not just enough to say schools will be provided with Veronica buckets and liquid soap. Some schools don't have access to water. And if the community doesn't have water, well, they're not going to waste it, quote unquote, on children washing their hands after every period. So I think that is the challenge we have, is that the best laid plans, right, if not implemented properly, create issues. The issue of when someone tests positive in a school, I've been, a number of colleagues and myself have been advocating for rolling out antigen testing. FDA has now approved a certain number of antigen tests. These are cheaper than PCR. And what we've been calling for is for the Ghana Health Service and the Ghana Education Service and the requisite ministries to roll out routine surveillance in schools using these antigen tests to get a clear idea of where the burden of disease is. Because simply waiting for someone to present with sick and then go and do some contact tracing makes us reactive as opposed to proactive. So probably what is required is a general surveillance of schools. If we want to keep schools open, then we have to do what is necessary to keep them safe. And I believe that getting a clear idea on the burden of disease, simply fumigating before students show up and then not doing anything afterwards, in my opinion, doesn't really solve the problem, because the disease is in people. When they show up, even if you fumigated the room, before long, that fumigation...
Is that to say disinfection, disinfestation, fumigation exercises really aren't doing that much?
Well, in many ways, yes, before a school opens, it's a good idea for it to be fumigated. But if you think you've done that and then you solve the problem, that you're mistaken, because when the students report, from wherever they come, if any of them were infected, that fumigation now doesn't mean much.
Becomes useless.
Yes, so you need to continue. The idea is, over time, you need to continue to have ongoing surveillance. You need to continue to have ongoing testing, random testing, to get an idea of the burden. And then you can divert resources away from places that don't have high burden and concentrate in places that have a higher burden.
So are taking our feet off the pedal when it came to testing, identifying, testing, contact tracing and the rest, and now trying to go back, that's been a problem. That has hampered our... now we see the numbers.
Well, I think now we've opened schools, we've got more people that require testing, right? So if you're focusing even on just school children, now they're no longer at home, they're in school. So we need to think of a strategy to continue to routinely have an idea of where the outbreaks are, deal with them so that they don't spread further.
0302-211-691 extension 2. That's how you can reach us. 0302-211-691 extension 2. Very quickly, there was a question on vaccination and the essence of it, basically. There was a question on that.
So, yeah, I'm very happy the gentleman asked that question. As an immunologist, my life's work is trying to find a vaccine for one thing or another. The reason we vaccinate is to protect people from ever getting a disease. Simply put, a vaccine primes your immune system to sort of remember a pathogen or a virus or some disease-causing entity, and in such a way mount a response when it is actually confronted with it. Our immune systems are designed and have the capacity to remember exposure. So once you are infected with something once, you remember it, and the next time you're exposed to it, you have a much better response. But normally you'd have to get sick first to develop that memory. What a vaccine does is it short circuits that process where you no longer have to get sick. The vaccine will just give you a piece of whatever it is that causes the disease, and in doing so, it doesn't make you sick, but allows your body to mount that memory response so that if you were to encounter it, you are protected. So in short, in simple terms, vaccines are administered to people who are not immune in order to induce immunity, in order to induce protection.
Right. But just on that bit, vaccines are not supposed to make you sick, but we've seen instances where in some cases they do make people sick, and that has been a concern even now. What would you say about that?
Yeah, I think
vaccines we have from Pfizer to Johnson & Johnson to all of the ones we're seeing now, AstraZeneca.
Yeah, I think I can't say this any more strongly, that vaccines are incredibly safe. Vaccines are some of the safest medical interventions known to man and are largely responsible for our survival as a species. You and I are here today largely because we were vaccinated as babies. So there's a lot of, I can't put it any other way, there's a lot of nonsense out there about, or misinformation about vaccines. A lot of it is wrapped up to look like science, but it's actually not science. Vaccines are incredibly safe. Yes, there are isolated cases where somebody has some adverse reaction, maybe an allergic reaction or something, things that could not be foreseen. But for the vast majority, well over 99% of people who are vaccinated are completely fine. We just, if you pick on the few isolated cases, people are allergic to paracetamol, right? No one is saying paracetamol.
So you can't really focus on those little bits.
Exactly.
Right. Let's quickly connect with Yaya in Zabzugu. Yaya, good morning to you. Your quick thoughts. Have we lost Yaya? Let's try Wahab in Talensi. Wahab, can you hear me?
Morning. Doctor, how are you?
I'm fine, thank you.
My question is going to talk about, the vaccination.
Right.
I mean, the vaccination. The vaccination that is yet to come to the country to investing people. I want to ask the doctor, what is his position concerned about the vaccine? Is it good or bad? Because we've been seeing on social media saying that this vaccine, they are trying to wipe out 3 billion people on the world, and it's going to kill about this 3 billion is going to take from Africa because we don't have any contribution to the world. And we've been seeing doctors confirming this as a fact, planning how they are going to kill Africans.
Right.
Yet this vaccine is coming to Africa. We know about it. Yet government is insisting on Africa to do this vaccine. So what is it?
All right.
We want to know the truth.
Right.
Is
Wahab.
it true or, it's not the truth?
All right. Your point is made, Wahab. We have to make it brief so that everybody can get a bite of the cake, a little slice. Nicholas in Sunyani. Nick, good morning.
Yeah, good morning.
Thank you. Very briefly, what are your thoughts? What are your questions?
Well, my first thought is, first one, Doc. The vaccines that they are bringing, is it for curative or is for preventive? Why I'm saying this is because are we going to be tested before we give the vaccine, whether you are positive or negative, to isolate those who are positive and those who are negative before they administer to those who are negative? Is that what they are going to do, or there will be a wholesale? We don't test. We just give it to everybody, whether you are positive or negative. And is it going to help? And lastly, I've seen people wearing masks, just the nose and the mouth. But the new variants that has come, we've learned it can be transmitted through the eye and the ears as well. So how are we going to prevent that?
All right. Thank you very much, Nick from Sunyani. I think the last one we'll take for now will be from Michael. Michael, thank you for joining us. What are your thoughts?
Oh, I just want to find out from Doc whether it's really possible for us to test all students, because it's going to pose a lot of economic pressure on government for now. I think it's in the best interest of everybody to make sure that we wear our masks follow the protocols. At the end of the day, we all need to survive this. Government is doing its bit in making sure that we all make it. Let's all do the right thing. Thank you.
Thank you very much. For this batch of questions, we'll just take a breather here and allow Doc to answer some of those questions. Dr. Bediako, I would like you to, pardon my, pushing you to the wall like this. I want you to start with the mask wearing bit. He's talking about the fact that, I think it was Nicholas, that now, you can still cover your nose, mouth, but it's said that the virus can get into your other orifices, your ears, your eyes. What's the take on that?
I haven't heard any. I don't know that it can get in through your ears. Obviously, your eyes, if you touch something and rub your eye, then potentially the virus could enter, which is why in the very beginning of this, we're told, try not to touch your face as much as you can. Keep your hands clean and then try to avoid, it's a natural reflex to always be touching our face. Just try not to touch your face.
You just did.
I just did, exactly. It's hard. But, I think most people, they should rest assured the most likely way you catch COVID-19, besides touching and putting your mouth or rubbing your face, is through your nose and your mouth when you breathe in.
It's more respiratory, right?
It's respiratory. The virus is in droplets that are released when somebody who is infected speaks or coughs. And these droplets cannot be seen, but they're sort of surrounding you. And when you breathe them in, they go in. Of course, when the droplets land on the surface, they can contaminate that surface. If you touch that surface and then touch your face without washing your hands, then you're at risk. But usually, if you're walking around town, you have your hand sanitizer, you keep your hands clean, you're wearing your mask, you're fine. So,
2 quick things on mask wearing. I just want to sneak them in. Recently, we heard Dr. Fauci of the CDC in the United States advocating, in a way, double mask wearing and even wearing your mask in a very snug manner or tight-fitting manner. Later on, soon after that, that assertion was debunked in a way. What is the reality of that? And I also want to find out about children under 2 not using masks. What's the rationale behind that? Very quickly, so we can move on to the other.
I think with the children, it's just, I have a 2-year-old. Getting a 2-year-old to wear a mask for a extended period of time is a lost cause. So I think it's just about some things. Yes, it would help if a child was outside and was wearing a mask, but you just cannot get a 2-year-old to wear a mask for a long time. It may actually end up being something that infects them. Because they'll get it dirty and they'll put it in their mouth and it'll be worse. So you might as well not have the mask on. Okay. In terms of Dr. Fauci and the double masking, I think it depends on what kind of mask you're wearing. In our context, a lot of the time, given the heat, people get quite uncomfortable with a single mask. So I would say if you can wear a double mask and it makes, there's no harm in it, but if it makes you hot and so you're more likely to pull it down, to your chin to get some fresh air, then probably just wear a single one that you can keep on all the time.
All right. William in Official Town, just hold the line. Let us wrap up with a few more answers and we shall come to you. William, so don't go off.
So I think the vaccine concern, is it going to kill Africans? Once again, I cannot say it any more strongly. No, the vaccine is not designed to kill African people. This is the same vaccine that is, so far, over 50 million doses have been administered around the world. Israel has vaccinated 20% of their population. America has so far done just maybe 2%. This is the same vaccine. We are trying to get the vaccine. We're not getting access to it because these countries that are supposedly trying to kill us are using the vaccine themselves and are not releasing any for anybody else to get. So there's no sense in that. Like I said, just because somebody wears a white coat and calls themselves a doctor does not mean that they know what they are talking about. And so I think when people see these pronouncements or on Facebook and all these videos, go and Google the name of this person and look them up. My name is Yao Bediako. Look me up, see what I have done. You can validate whether or not you think I'm a credible scientist or not. Do the same for these people who are so-called professors or so-called scientists and make up the decision for yourself whether they are somebody you should trust. 99.9% of scientists around the world are talking the way I am talking. That small 0.1%, well, it's up to you to decide if you think they are credible versus the rest of the community of science.
And just to reinforce that point on vaccines, I don't know whether you were the one I heard recently talking about the fact that in a lot of vaccine trials, people of black descent or black people don't participate. And so it makes it difficult even, because you have a lot of people from other parts of the world, the West, the East, Asia, and the rest, getting into these vaccine trials. So the vaccines are more tailor-made, but for us, we don't participate. We have this tendency to think about these theories and assume that, so it becomes problematic. How problematic can that get?
Oh, I think it's very problematic. I mean, it doesn't just apply to just COVID. I mean, we have an issue where vaccine trials have historically not been representative, especially there's been a huge disparity between the people who are involved in vaccine trials, which means that when vaccines are developed, they typically actually work better in populations of Caucasian descent than African. So actually, instead of being afraid of being part of clinical trials, we should be advocating to be included, obviously with the proper controls, the proper regulations to make sure that these trials are safe. But the idea that we should not want to be guinea pigs, I think ignores the actual point that who should be a guinea pig for us to benefit, right? This is a global problem. We should all be looking to contribute. And actually, countries like South Africa, the reason South Africa has had vaccines delivered first is because we're the only African country, or one of the only African countries, to be involved in vaccine trials. Kenya has also had a few vaccines because they were part of the trial. If we don't contribute, then we are at the back of the line.
Okay, let's add these questions, assuming we still have, I don't want to keep William on the line for too long. William, are you still there? Are you still there, William?
Yeah, I'm still there.
Thank you. Thank you for holding. William from Official Town. What are your questions?
I want to find out from doctor whether, like, this time around, many people are having this catarrh and sore throat. And I want to find out whether we are suffering from any kind of infection.
Okay, all right. We also have Brian from Tamale. Brian. Hello, Brian. All right, let's move on to Abla from Achimota. Abla, good morning to you.
Hello.
Achimota, right.
From Achimota.
Right, thank you for clarifying. What are your concerns, Abla?
My concerns are I have a two-month-old baby. I have a 5-year-old boy. And then
Oh, did we lose Abla?
Hello?
Yes, we can hear you. Please go ahead.
Okay, I have a 5-month-old, a 5-year-old boy and a 2-month-old boy.
Right.
And then since schools open, I'm scared to make the 5-year-old boy go to school because I'm scared he's going to get infected and then infect us in the house.
Wow. Genuine concern there. Thank you, Abla, for sharing your thoughts. We have, okay, so Ajile in Buife. If I murdered the name, do pardon me.
Actually, you murdered my name.
I have. Oh.
Yes. The name is Ajile.
Ajilo.
Ajilo.
Ajilo. Okay.
Yes,
Please go ahead with your thoughts.
All right. I'd like to find out from the vaccines are administered.
Ajilo, could you speak up for us? Speak up a bit.
I said the vaccines are administered. They are administered to the people to boost their immune system. Now, someone who has recovered from COVID. Hello?
Yes, we're listening.
Yes, someone who has recovered from COVID already. It means that the person might have developed some immunity in case of subsequent attack from the same. So what differentiates such a person from someone who has not been infected but the person has taken the vaccine? In terms of defense, each of them stands a more stronger.
All right.
We did something stronger in terms of the attack from the virus again.
All right.
The one who recovered and the one who.
Ajilo, thank you very much. I totally understand where you're coming from. Joe in Hohoi, we'll take this for the last batch because we didn't exhaust the answers for the batch before, and then Doc will quickly answer those. So, Joe, over to you. Your questions.
Yes, good morning. Mine has to do with how effective is fumigation. Hello?
Yes, Joe, we are listening to you.
Yes, how effective is fumigation after infection? So, for instance, you have officers, and then when we have infection at the offices, we often hear that they call on black people to come and fumigate the place. And how long should it take for us to reuse the offices? Then I want to use your platform to complain about an issue in Norway. Ghana Education Service, I heard the Director General of Health and people having the briefing, mentioned that they were going on monitoring this week. Since they reopened school, most of the schools are even sitting 2 students in a short desk, a very small desk. And then the video you showed at the beginning of your program with the boy washing their hands in a bowl instead of under the tap.
Yeah.
I don't think the situation is different in Norway. It is across the country. So if Ghana Education Service can step up the monitoring I think it will help. Thank you.
Thank you so much for calling through and sharing your thoughts. I'll just add this one, this bit about erectile dysfunction. We've been talking about it in men, but I guess that's the focus. How about women? I've had a few female friends share with me their COVID stories, and they've shared, does it affect the menstrual cycle, for example? Maybe let's add that to the questions and take them bit one after another, but pretty quickly so we can move on to the next one.
Okay. I think I'll take there was a question about vaccines being curative or preventative, and I'll link this to the idea of vaccinating immune people. So the vaccines, as I said before, are preventative. They're not to cure. So if somebody is sick with COVID, giving them the vaccine is not a treatment. Vaccines are not treatment. They're meant to be sort of taken before you get exposed. The gentleman who asked about people who've been infected and recovered, it's actually a very good question. It's something that actually scientists around the world are trying to answer. There is evidence that you can become reinfected. So there are people in Ghana who've had COVID twice. Some people have even had it 3 times. So it appears as though natural infection does not really give us enough immunity to prevent subsequent exposure. So the idea of whether we should vaccinate everybody or just vaccinate those who have never had COVID before is a tricky one, because also we don't know how many people have had COVID because we are not testing everybody, right? We're only testing those who have been sick. So currently, I think the protocol will be to just vaccinate people. We'll probably do it in phases, starting with the most at risk. So elderly, people with underlying conditions, health workers. And as we get more vaccines in, it'll begin to expand to other segments of the population. In some countries, they have wondered whether, whilst vaccine stocks are in short supply, whether we should prioritize those who've never had it before. Yeah. Because those who've had it maybe have a measure of protection. And then some
countries have decided to give 1 shot and just hope
and that has been
it does better for those vaccines that require 2 shots.
Yeah, and that is sort of controversial because the vaccines were designed, many of them, for 2 shots. If you just give 1, so the UK has taken the thing of trying to spread out their doses, so they've just given 1. Yeah. There's evidence that it gives some protection, but it may not be as protective. But of course, in this emergency situation where you just don't have enough vaccine, you have to make some of these decisions. So it will be interesting to see what we decide to do in Ghana, whether we use the 1 dose or whether we actually give people the 2 doses as recommended.
And just to add up, we would have the option, right? Because the Johnson & Johnson one is 1 dose.
So the Johnson & Johnson vaccine is the one vaccine currently available that is meant to be given in 1 dose. All the other vaccines are 2-dose vaccines given about a month apart. So in the US, they are giving the 2-dose regimen. In the UK, they decided to delay the 2nd dose. Not that they're not going to give the 2nd dose, but they are giving as many people as they can 1 dose, and then they're going to come back and give people. Now, some people have gotten COVID after the 1st dose, so there's a little bit of concern about that. But you're weighing a lot of factors when you decide to do what you want to do. Fumigation in offices. Yes, it's important. If you've had an outbreak, the office should be fumigated. But as I said, fumigation alone is not going to really solve your problem. Effective contact tracing and testing of people in the office. If it was left to me, if one person in this studio tested positive, we should all be tested to confirm whether we have contracted it. Simply fumigating the studio, but letting us come back in without testing, whoever is potentially infected is just going to infect the place again. So fumigation is important, but in its way, fumigation is sort of a minor tool. The real tool is identifying individuals who are infected and isolating them to prevent further spread.
With this virus, the more you know, the better you can tackle it.
Exactly. Let me see what the next questions are. The parent afraid to send her 5-year-old to school. I mean, I think that's a very difficult one. To be honest, I don't think it is for any of us to tell a parent in that situation what to do. If there's a way for your 5-year-old to learn remotely, there are some schools that are still doing online teaching. They're sort of minimizing how many days children come in. If that is an option and you have someone to look after him, or you yourself are stay at home, potentially that is something to do. Given that you have such a young child, I fully understand the concern. I would say for parents whose kids have to go to school for whatever reason, when they come home, put in your own safety protocols. Let them take a shower, spray down their backpacks and their pens and stuff before they bring them into the house. Make them take their shoes off before they come in.
Those should be washed more frequently.
Wash their uniform as frequently as you can. If you can, wash it, have enough that you can wash every day. Of course, these things we have to be constrained by people's economic circumstances. But maybe even most importantly, pay attention to your children's health. If they have a little runny nose, a little cough, don't just ignore it and think, oh, it's just a little bit of flu or malaria.
Could be COVID.
Right now, and I think this fits with the gentleman talking about the symptoms. Right now in Ghana, if any of us feel unwell, our first thought should be, is it COVID?
Right.
Now, COVID testing is free, is very readily available for at least a large number of people. If you can, and you feel a little bit unwell, don't assume it's malaria. Before you get the malaria test, get the COVID test, because you're more likely to have COVID than to get malaria right now.
On to the next one.
Let me see. I think we've covered most of them. Was there one that I missed?
How about the one about, so we're focusing on men and erectile...
Oh, erectile dysfunction, yes.
What's happening to the women?
I don't know what COVID appears to be a disease that can affect any part of your body. So people are reporting every day there's a new side effect or a new effect of somebody who has recovered from COVID. I think in general, the warning or what people should understand is COVID can stay with you for a long time. Even after you've recovered, people are reporting a host of downstream symptoms and difficulty in getting back to normal. And so I think it should just be a cautionary tale. There's not much you can do. You just have to hope that you're able to recover. But I guess what we can do before we get COVID is to do our best not to ever get COVID in the first place.
Okay. I think we just might have enough time to pick these two callers and sneak in another question. But just on the back of that, I have two friends who have told me that it has affected women. It has affected their monthly flow.
That is entirely possible.
Henry in Kenya, Henry, good morning.
Hello, good morning.
Thank you so much for joining us. What are your concerns?
I want to ask one or two questions. Is the vaccine made for tropical countries? And my second question is, the nose mask, can we make some hole, a round hole in between it, so that we can put rub or something that you can inhale, so that the wearing will be very easy? Because sometimes when you wear it, the breathing becomes difficult. So if you make some hole where we can inhale, maybe rub, something being put there.
All right.
So that in the hot season, hot places, you can put it on easily.
Henry, thank you very much for sharing your thoughts. But I'm thinking from a layman's objective that even touching the mask and all of that, you could be contaminating it even before you use it. Ofosu in Kumasi. Ofosu, what are your thoughts?
Oh, thank you. Mine is simple. When you take 1 or 2 doses of the vaccine, what is the period of immunity? Period of immunity, your protection?
All right. Thank you for sharing your thoughts. I think that's where we'll wrap it up when it comes to the comments coming through, the calls. Quickly on that, and then we'll wrap up with a few more thoughts.
So right now, the evidence, because obviously everything is being done in a very short time, we still are studying the effects of vaccination. We're still trying to understand how long the protection lasts. There's evidence that you should have protection at least for 8 to 9 months, possibly longer. So I would say right now, the thinking is it probably gives you protection for between 8 to 12 months. And that emphasizes the need to deploy these vaccines very quickly. Because if we take too long to deploy, the people we vaccinated first will now need another booster. And we're not even sure if boosting will necessarily work.
Okay.
The challenge with the vaccine is also the variants. So if we don't get the vaccines out quickly enough, variants will emerge that are not covered by the vaccine. So really the focus should be, hopefully the government is working extremely hard to get vaccines here in large numbers. Then as citizenry, we need to avail ourselves to get vaccinated as soon as we can.
Very quickly, I think there was a question that we skipped. It had to do with this. The other end of someone who has got COVID, what is the immunity like? For how long? That was another question.
So that is a little bit harder to determine. Right now, like I said, there are people who've got COVID once and have not been reinfected. There are a lot of people who have had COVID even months apart. So that's what I mean by natural infection. The idea very early on, there were talks in countries like Sweden and elsewhere that just let people get it and that will build herd immunity. It appears that natural infection is not a good route to develop herd immunity, and actually immunization will be necessary. So protection from, I think not somebody who's been infected with COVID, I know people who've got COVID like literally a month after recovering.
Right.
So
I've heard between 1 and 6 months. I mean, depending on the person.
The antibodies may be around, so we've done a lot of antibody testing. You can find antibodies 3, 4, 5 months afterwards. But whether these antibodies are protective is another thing. So just because I find antibodies in you doesn't mean that if you got exposed to COVID again, you would.
So the second person, this was Ofosu Kumasi, was asking about holes and other things in your mask. What?
I think the general wisdom is that you want they want a sort of a complete membrane to prevent anything being released. Having holes, I understand, may make drinking or eating easier. But even now, with those those masks that we had before that had the vents actually have been banned in certain countries because the vents actually, when you breathe out, they allow the air to come out. So actually they are not a barrier to other people. So the vented masks actually are things we should stay away from. They're actually not, they've been shown to actually promote transmission.
Okay, to wrap up, Doc, it's been exciting talking to you, learning from you. But the AstraZeneca vaccine, which is what we're bringing into the country, South Africa has put it on ice in their country. They're even thinking of selling some of them because its potency against the South African variant is something else, below 10%.
Yeah.
So we're ordering this. There's a likelihood that it could become redundant even before it gets here, right? What's the reality? Final question.
The reality is we are in a war against this virus, and this virus is constantly changing. The more it transmits, the more it goes from person to person, the quicker and quicker it mutates and changes. Right now in Ghana, the evidence we have is that the predominant variant is the variant that was discovered in the UK, which thankfully is still covered very well by the AstraZeneca vaccine. In South Africa, the issue they have is, at least for mild and symptomatic cases, the AstraZeneca vaccine has been demonstrated to have very, very low efficacy. If that variant was to emerge in a big way in Ghana, we would be faced with a similar issue. So I think for now, AstraZeneca vaccine is the best choice. I am assuming it is not the only option the government is considering. We'll need more than just one type of vaccine in this country, just based on the numbers. For now, measures should be taken to try to get as much into the country as quickly as possible and to vaccinate as many people as possible. The longer we allow this virus to transmit from person to person, the more chance we give it to mutate, to become a variant, whether it's a South African variant or whatever variant it is, that may not be covered by the existing vaccines. It's taken us 12 months to get this vaccine. That already was a world record, and took hundreds of billions of dollars and commitment to try to get these vaccines. We cannot afford to let these vaccines become ineffective before we deal with COVID. And the only way we can do that is to vaccinate. We need to vaccinate 75% of our population to hit the herd immunity threshold. That is vaccinating well over 20 million people. And if it's a 2-dose vaccine, then we need 40 million doses. So that is what we should be, those are the numbers we should be thinking of. But whenever vaccine becomes available, we as citizens of Ghana have to avail ourselves, cooperate with the health authorities, and get vaccinated.
Dr. Bediako, you've been a wealth of a resource. I'll give you a fist bump in the air. Thank you so much for joining us. For all of you who actually called through as well, thank you very much. Joshua and Tema, my apologies that we cannot take your call. My sincere apologies. Thank you all for getting in touch, sharing your thoughts. It's time now for Showbiz with Caddy as we wrap up on the AM show.